everyone. And good afternoon, maybe somewhere it might be mid-afternoon. So welcome to this conversation. As you know, the World Mental Health Day is usually celebrated on October 10th. Today, it is October the 15th. And it is precisely because we wanted to give you some time so that the countries and the people who wanted to celebrate October 10th could have that day to celebrate. And October 10th, the World Mental Health Day has as an objective to raise awareness about mental health problems all over the world and to mobilize efforts in order to support mental health. That day is an opportunity so that all the key stakeholders, the key people who work on mental health can talk about the work they do and what else should be done so that mental health care would be a reality for each one of us in this world. The theme for this year is time to prioritize mental health in the workplace. So welcome, everyone. Welcome to our roundtable. My name is Claudina Cayetano, and I will be moderating today's panel. So let us get this going. First of all, let me tell you that this roundtable will be interpreted into 3 languages. So you can log on and follow the conversation in the language of your choice. It could be Spanish. We're now speaking Spanish, but it could be in English, and it could be also in Portuguese. It is also important for you to know that we'd love for you to ask questions, and there is a possibility for you to send us your questions, and we'll be glad to give you some space so that we can answer the questions. We know that we have over 4,000 people that have signed up for this conversation, and we're very pleased if you're able to join us this morning, so welcome. And in order to get this going, I'd like to start with introducing the head of the mental health unit at the Pan American Health Organization, Renato Oliveira. Renato will be extending to us some words of welcome so that we can begin this conversation. Please go ahead.
Thank you very much, Claudina. Good morning, colleagues. Thank you for joining us today for our panel, Prioritizing Mental Health in the Workplace, Strategies for Success. As we come together, it's important to recognize that mental health challenges at work aren't just individual concerns. They are a collective issue that affects the well-being of individuals, organizations, and our region as a whole. In the region of the Americas, mental health conditions have surged, while services still struggle to meet the growing demand. 1 in 4 people in the Americas will experience a mental disorder or a substance use disorder in their lifetime, and approximately 100,000 individuals die by suicide each year. Despite the need, the treatment gap for adults is staggering at 73%. Beyond the individual and organizational impacts, mental health conditions also have significant economic repercussions. The World Health Organization estimates that depression and anxiety disorders alone will cost the global economy approximately $1 trillion each year in lost productivity. With 60% of the global population at work, governments and employers can take action to improve the well-being and health at work by protecting and promoting mental health at work, preventing work-related mental health problems by targeting key risk factors affecting mental health at work, and supporting workers with mental health conditions to participate and thrive in the workplace. Today's panel aims to share effective strategies that governments, employers, and organizations can implement to protect and promote mental health in the workplace. Strategies that are especially crucial in today's fast-paced environment, with the objective of contributing to healthier individuals, organizations, and society as a whole. Throughout this panel, we will delve into these strategies and more, exploring actionable insights that can empower leaders and workers. Our goal is to inspire a shift in how we view mental health at work and to create enabling environments, fostering a culture of open communication, reinforcing the message that seeking help is a strength, not a weakness, and that mental health is key to organizational success. When we feel safe expressing our concerns and sharing our experience, it creates an environment where mental health is prioritized. Now, I will pass the floor back to our moderator to guide us through today's discussion to create healthier workplace. Thank you very much.
Muchísimas gracias.
Thank you very much. Thank you very much, Renato, for your words, such encouraging message that invite us to ponder upon the importance in that search for help. Looking for help is a sign of courage and not a weakness. I love that. That's really important. And I also liked what you said, saying that nowadays mental health has a lot of visibility, but we still face a lot of challenges when we talk about services. And this leads us to the importance of prioritizing mental health in the workplace. Very well. Let us now go on to our panelist. And let me just say that we feel honored to have three outstanding panelists, very talented people with us today. Our first panelist is an advisor on mental health of PAHO, Carmen Martinez. Carmen works with us, giving support to mental health in Central America, Mexico, Dominican Republic. Carmen, thank you very much for being with us today, and it would be wonderful if you could tell us a little bit about this.
Muy buenos días. Muchísimas gracias,
Good morning.
Claudina,
Thank you very
Renato.
much, Claudina and
Con gusto, soy
Renato.
Carmen Martínez
It's a pleasure. My name is
Viciana.
Carmen Martinez Viciana.
Estudié psicología,
I studied
después desarrollo
psychology
internacional
and then
y acción
international
humanitaria
development
y salud
and
pública
humanitarian
también.
aid and public health.
Y he trabajado
And
fundamentalmente en
I've
el ámbito
worked
de la
essentially in the
cooperación
field
internacional
of
y en el ámbito
international
humanitario desde
cooperation
el
and
2016 en el puesto de
humanitarian action, and
asesora
since
regional de salud mental y
2016
sobre
as
sustancias.
regional advisor to
Y
mental health and
actualmente
substance
estoy
abuse.
con base
And
en la oficina
currently,
en
I
República
am
Dominicana.
based in the Dominican Republic, in
Además,
the
soy
office
madre
in
de
the
dos
Dominican
hijos
Republic.
maravillosos.
I'm a mother of two
Intento
wonderful children, and
compaginar,
I
¿verdad? mi
attempt
trabajo
to
con la vida también
match
familiar
my
y
work with a
social.
family life and
Y
social
quizás me
life.
gustaría también
And perhaps
compartir que
what I'd like
durante
to
la
do is
pandemia
to let you know that
estuve
during the
activamente
pandemic,
apoyando
I
todo
was
lo que fue la
actively
respuesta,
supporting
¿verdad?
everything that has to
de
do
la
with the
pandemia por
response
COVID-19
to
en
the
todo el
pandemic
continente a la salud
caused
mental y a
by
la cohesión
COVID-19,
social, que fue
mental
tan
health and
importante, que empezó a
psychosocial
tomar
support.
tanta
It
relevancia,
was
¿no?
so important and
Y
started picking
trabajando
up
en una
in
red cerca,
importance,
especialmente
and
con el
working
personal
so closely,
sanitario,
particularly with the
pero
health
también
personnel,
con
but
mis propias
also
vivencias de
with
la
my
demanda
own
laboral que supuso,
experiences,
¿no?
the
Con grandes
demand in the
desafíos.
workplace that this entailed, facing huge
Tomé mucha más
challenges.
conciencia de la
And I
relevancia que
became
tenía
much
la
more
salud
aware
mental
of the relevance
en
of
el
mental
lugar
health
de
in the
cómo podemos
workplace
hacer desde diferentes
and
niveles
how
para
we
estar
can
apoyando
work at different levels in order to
protegiéndola,
support
¿verdad?
it, to protect it.
Y de alguna
And
manera
in
eso
a
hizo
way,
que para mí tomara mucha
I
más
feel that
relevancia
for
y de
me,
alguna
it
manera
picked up in
a
importance, and in
nivel
a
del
way,
equipo también
at the
estamos como
level of
trabajando en
the
gran medida
team, we're also working to a large
para
extent in
intentar
order
aunar
to
esfuerzos en este
attempt
sentido.
to join
Gracias.
efforts in this regard. Thank you. Thank you very much for being with us today. And I loved that personal touch because I believe that it is very important since we're talking about the importance of our mental health and the importance of the work we do and also at home. So thank you, and I'm glad to have you with us. Our second panelist is Maria Mendez. Maria is an activist, a founder, and chairperson of the organization. Vacations is a human right, and she fights for achieving a balance between work and personal life. And Maria, please tell us a little bit about you. Thank you very much, Claudina and Carmen, for the invitation. It is an honor, truly an honor to be here. My name is Maria Mendez, and for over 25 years, I've been involved in planning of travel logistics of top executives and artists at a world level. Besides, as Claudina mentioned, I'm a founder and president of a non-profit organization. Vacation is a right, a human right, devoted to promoting the importance of taking breaks in order to avoid burnout. And this idea came out of my own experience because in those 25 years, I spent 16 years without having a day of vacation, working 24/7, which led me to face a burnout, a complete burnout. I'm very happy and I feel very supported in having the courage of appearing before you at this session and being able to share with you my experiences. So once again, Claudia and Carmen, thank you very much for the invitation. It seems to me that a voice leads to a lot of change, but when we have united voices, I feel that the change will be much greater, and I'm truly grateful for this space. To you, our gratitude, Maria. We feel very honored that you accepted the invitation to be with us today. So welcome, and I know that the panel will be delighted to hear what you have to share with us. So our third panelist is Fernando Tomasina. Fernando is a physician, a professor at the University of La República. Fernando, welcome, and tell us a little bit about yourself. Thank you, Claudina, Carmen, Maria. It's a pleasure to participate in this virtual panel to talk about something so dear to us, such as prioritizing mental health in the workplace. Personally, and also appealing to my personal experiences and the difficulties in sharing and coexisting with the times and the needs of family life, social life, and our work. Sometimes it's a conflict, and we have to learn how to solve this conflict and do it in a favorable way by looking for these breaks. I'm a father of 4 children, and now I have 4 grandchildren. And at this point in my life, I'm trying to reconcile much more the social and family life and the social needs with the workplace. I'm going through a stage in my life in the workplace, my academic life that allows me to do that. But I believe that this is necessary if we want to humanize relations in the workplace that will respect and value the aspects that have an impact on our social personal life. My experience is in occupational health at the university. I have a background in public health in general, but in order to articulate this, I've had great experience in the academic world for the last 35 years. Thank you very much. And let's hope that we can exchange views, ideas that would be of interest and that would be fruitful, that we hold a fruitful exchange today. Thank you very much, Fernando. For us, it is also a pleasure to have you with us at this panel. This is a deluxe panel to talk about the importance of mental health. So let us begin. We know who our panelists are now. So let us get this going with this conversation. And as I said previously, the purpose of the World Mental Health Day, precisely this year, is to prioritize mental health in the workplace. We had already said that every year we have a new theme, and the slogan for this year is prioritizing mental health in the workplace. So let us begin. So my first question will be for our advisor on mental health from PAHO, Carmen. Could you please share with us, from your point of view, the current status of mental health in the workplace, and what are the most urgent and overwhelming problems that you've had the possibility of seeing?
Gracias, Claudina. Yo creo que
Thank you, Claudina.
empezaría un poco
I would
situar
begin by
el trabajo, el empleo,
placing
como uno de los
work
principales
employment
determinantes
as one
para
of
la
the
salud
main
mental, ¿no?
determinants for mental
Es verdad
health.
que junto con
It is
otros
true
elementos
that together with
socioeconómicos,
other
como pueden
socioeconomic
ser
elements,
la
such as is the
situación de
case
pobreza,
of
el
being in a
acceso a
situation of
vivienda,
poverty,
la
access to
educación,
housing,
o
education,
también vivencias
or
como pueden
also
ser la violencia u
experiences such
otras,
as violence
forman
or
parte como de
other
esos grandes
events are part of those big determinants of mental health that have been clearly documented and identified. And in that regard, that access to employment and to the conditions in the workplace might have an impact on health in general and mental health in particular. And not only is this a matter of having access to work, but it should be work in dignified conditions, that it offer conditions that enable well-being at all levels. And unfortunately, the precarious working conditions are a serious problem in the region of the Americas. Now we know that in Latin America and the Caribbean, almost 55% of the labor force has informal jobs, therefore no contract, no social security coverage, and therefore we see this with a significant level of risk for mental health. And if we add to this the fact that there are populations that are uniquely vulnerable, such as some indigenous people, Afro-descendants, and migrant populations, and also if we think about gender issues, women also face a greater risk because to a larger extent, they have to deal with conditions that are in less decent jobs, lower wages, insecurity, and discrimination as well. And we live that in any one of our spheres of life. And clearly, this is something that we see in the workplace. Also, if we think about the pandemic, the COVID-19 pandemic, certain groups such as health workers, we worked so closely with the health workers during the pandemic, and we know that they had to deal with highly stressful factors, a significant work environment, but dealing with situations of high risk, having to deal with patients that were severely sick, high mortality rates, and in general, an emotional impact, a very significant emotional cost. And we spoke of heroes at some point, with all the positive and not so positive things that we can find with those terms. But I would also wish to mention other groups such as essential services workers, those who worked in supermarkets, in the food stores in general, logistics services, and they were also exposing themselves, and they suffered because of the work they did beyond what the population at large was going through. And in a way, what we've seen with the pandemic is that this has disrupted to a large extent many issues, and in particular, issues that have to do with the workplace. We've seen significant changes that have been introduced, also leading to some stress factors. And maybe we were not so used to them. The issue of labor reconciliation is one of the very clear events. There are increasingly more and more difficulties. And if we think about our surroundings, it is increasingly more difficult to achieve that balance between the labor life and our personal and social life, but also other matters that there has been a trend to physical exhaustion in the workplace. Even with the good things that it brings with it, it also has its consequences. And I believe that today the example of being in this roundtable virtually, hopefully we could have done this in a roundtable and having some coffee, seeing each other. We have to do it virtually because it's very easy for us. We're talking from Uruguay, from the US, from the Dominican Republic. We're all from different places. And with all the people that are following us and that are sharing with us this virtual space from many countries in the region, but we've also seen on the chat some people that were saying hello from different corners of the world, and that is wonderful. But it also brings with it a whole set of challenges. So, in a way, not only with the pandemic, but in general, how we see that the labor
genérica de algunas
world
cuestiones
evolves in a
implica que
very
reconozcamos
frenetic
cuáles son
way
esos impactos,
implies that
¿no?
we have to
Y que
acknowledge what
podamos
the impacts are,
diseñar las
and that we
intervenciones, las
can
respuestas
design
que sean
interventions
realmente
and the
efectivas
answers for
y
these
que
to
den
be truly
respuesta
effective,
de
and
manera
that they
inclusiva
will
para
give
de
an
manera también
inclusive
incluso como
response and
sensible, ¿no? A los
a
diferentes
sensible,
sectores, a los
paying
diferentes grupos,
attention to
a
the
las
different
diferentes
sectors, the different
necesidades que no
groups,
siempre son
and the
tan,
different
tan
needs
comunes. Así que
that
bueno,
are
yo
not
quería un
always so
poquito
common. So I
comentar,
simply
así
wanted
como
to bring this up
estos grandes
and talk about
impactos y lo que hemos
these
estado viendo,
huge
porque
impacts and what
realmente
we've seen,
requieren un
because
enfoque
they
muy
do call
integral
for
desde
a
diferentes
very
sectores, que implica que
comprehensive
tenemos que estemos como muy
approach from different
pendientes
sectors,
a todo
and
esto,
we
a
have to
desde
follow
las
this
diferentes
very
posiciones en
closely
las que
so
estemos,
that from our
podamos
different
contribuir
positions
a
where we
proteger la
are,
salud mental.
that we can contribute to protecting mental
Carmen,
health.
muchísimas gracias.
Carmen, thank you
Me
very much.
encantó mucho tu
I loved
comentario
your
sobre
comment,
que este es un tema apremiante para
saying
todos.
that
Me
this
encantó el
is
enfoque, el
an
trabajo
urgent
como uno de los
matter for
principales
everyone,
determinantes de la
and
salud,
the
que
approach
es muy
as
clave
one of the
de lo
main
que se puede
determinants
hacer.
of health, what is
Bienvenidos
key
de
and what can
nuevo
be done.
a
So
esta
welcome
mesa
again
redonda, a
to
este
this
conversatorio.
roundtable, to this conversation.
Me da muchísimo gusto ver en
I'm
el
very
chat
glad to
todas las
see
personas
in
que han
the
logrado
chat
reunirse con
all the
nosotros.
people that have been able to join us
Empezamos
today.
esto justo a
And
tiempo,
so
empezamos a
we
tiempo
began
y
this,
empezamos
we started on time
para que ustedes tengan la oportunidad también de
for
hacer
you
sus
to
preguntas,
also have
porque si
some
al
time
mismo lo pueden
to
poner
ask
en
your
el chat
questions.
ahí
As
en
we
el
said
question and
previously, you
answer,
can
vamos a
include
tener
your
espacio para
questions on the
poder responder.
Q&A, and then we'll have some
Entonces,
time
muchas
to
gracias,
answer your
Carmen. Y
questions. So
ahora
thank you
le
very
voy a
much,
dirigir
Carmen.
a María
And now I will
para que
address
María
my
nos
next
pueda
question to
dar,
Maria so that
como les
Maria
mencionaba,
can
María
give us,
Medina,
Maria
desde su
Medina, as I
organización,
was
las
saying, from
vacaciones
her
son un derecho
organization,
humano. Ella aboga
vacations
por
are
ese
a human
derecho a los
right, and
trabajadores
she fights
descansar y a
for their
cuidar a las
right for
familias.
workers to
María, ¿cómo ves las
get breaks
vacaciones con
and
las
to
pausas y el equilibrio
release
para la
energy? How do you
recuperación?
see the
¿Cuál es la
relation between the
estrategia para
workplace and
reducir
social life as a
problemas como
strategy to reduce and to avoid burnout? Excellent question, Claudina. Thank you. As a tourist entrepreneur and the founder of a Vacation as a Human Right, I'm a natural promoter of taking free time in order to reload. The breaks, I believe, that are essential, taking time and making pauses in order to strike a balance between work and our personal life. I feel that we've sort of lost the sense of what the vacations should be. They have a purpose in order to create the memories. And every time you remember this, you will live again and you will rest more. I believe that the vacations are not touched and are not seen. It is something that you feel in your heart and in your soul. And that is why we need to know how to plan vacations that have a purpose and that leave a footprint. And in order to answer your question, I also want to talk about the result of a lack of balance between my work life and my personal life, because that will allow me to express the importance of striking a balance. As I told you at the beginning, I went for 25 years without taking a vacations. Out of the 25 years, for 16 years, I did not take a break. And that led me to a burnout at all levels, to the point that I started realizing when one of my colleagues was asking questions, very routine, normal questions, and I had to touch my keyboard in order to answer. So one day I said, I think that my brain just went to my fingers. What's happening with me? And I started to look into that, and then I was diagnosed with a chronic burnout. And I was saying, how do I get out of this? How do I get out of this situation? Because I made a huge effort in order to do everything right. I wanted to move forward and move up in my job, and I realized that I was facing a system in emergencies. So when you have your cell phone on emergency, when you're running out of batteries, that is how I felt. And I was only willing to solve what was urgent, not what was important. So when I realized all of this, I started looking for help. And now what I do differently in order to strike a balance between my personal life and my work life, because I have to acknowledge that I'm in an industry where it is difficult to have pauses and breaks, where you have so many important clients with different schedules and emergencies 24 hours a day. And so after acknowledging this, I started implementing a few things in my life. And the first thing I learned was to deal with my emotions, to acknowledge what I feel and how to manage that. And then the second thing that I learned was to work by not clinging on to something. When I felt that if I did not talk to my client, the vacations would not be okay, the tour would not be okay if I didn't touch it, without realizing that behind me was a wonderful team that was ready and willing for me to leave everything in their hands so that they would also develop and grow. Having this detachment, it was very difficult for me, but I planned how to detach. And the third thing that I learned was to understand the power of serene force and to learn how to say no. And this was something that was very difficult for me because it was one of the most difficult things for me. Because throughout the entire time I say, yes, it is possible, don't worry, no problem. And for me, I never faced a problem without a solution. So that was the most difficult thing for me because it took a lot of time from my life when I had to say no. So I learned how to work on that too. I no longer sleep with the phone next to me. I used to sleep with a cell phone. I was connected to my cell phone 24/7, and now I turn it off when I go to the movies, and I decide when to answer my calls. On my calendar schedule, we have when I'm taking some time off and when I can take a break. And what do I promote and I practice with my fellow workers? Well, the first thing I do, and I know that you will laugh when I say this, but this is what I do. In the morning, I get immunized with patients so that I can understand the sense of humor of each one of my fellow workers and to know how to offer support. I make sure that they take a lunch break, that they take some time off and vacations during the summer. I give them an afternoon off every day, once a week, that they take their family days twice a year. I offer personalized sections with professionals to learn how to deal with the stress situations that we face, which are normal in our business, and how to manage that time. And that's important for them to be safe and feel safe. And finally, I firmly believe that when a worker knows that the company, the business, the organization respects their time, that they're allowed to reload their batteries and their energies, and that they enjoy their personal life, they're much more willing to give 100% without the reservations. I've come to realize that this is not a matter of demanding or asking for more, but to create the conditions so that the talent of each individual will flourish in a natural way. When businesses or companies take responsibility for the well-being of their people, will not only avoid the stress, chronic stress and burnout, but we also make sure that our fellow workers will give the best of themselves with passion and loyalty. And last but not least, it is a matter of understanding that a team that feels looked after and cared for is a team that gives its all. They innovate and they push the organization towards success. That's all I have to say for the time being, Claudina.
Muchísimas gracias, María. La verdad
Thank you very
no
much,
sé si
Maria.
pudieras ver,
And the
pero
fact
hay
is,
muchos
I don't know if you could see
corazones,
this, but I
muchos
see lots of
aplausos.
hearts and applause just coming to the
Imagino que este
surface.
signo
And I'm
de que las
assuming that this is a
personas
sign
votamos en
that
lo que trabajan
everyone
para nosotros.
recognizes
La
what you just
importancia de
discussed.
que pueda
And
este
underscoring the importance that the role of having vacations and downtime and rest is not a luxury. This is something that we need. And I think Maria has already clearly stressed that these things, rest and vacation time, is closely connected with labor productivity. And if we can understand the significance of that, we can be much more innovative and we can give it our all when we're aware of these priorities. I think in just the last few minutes, we've learned a great deal about this. And we're going to get back to you, Maria, later on because we've got a lot of questions. But now I would like to offer the floor to Fernando, our third panelist, to share his experiences. Maybe you can discuss some of those protective measures that have been very effective in promoting mental health in the workplace. Now that we've heard Maria's comments, I think this dovetails perfectly into your discussion of the key protective measures in providing that mental health in the workplace. Thank you, Claudina. I think, first of all, we need to focus on the need to identify some of these ambiguities. They're risk factors that are posed to health, and there are other factors that contribute to a healthy environment. Those protective measures, that's part of the undertakings that we are involved with that have helped to strengthen these aspects. One of the things that we have noticed in some of the specific projects where we're able to develop activities where we've created a more conducive work environment for health, also to create a decent work environment. I think we need to look at, in particular, the role of the workers, their participation in the workplace. We know that in the workplace, there's been a loss of a feeling of belonging and working with the coworkers. I think this is something that has a repercussion in the individual's feeling of self-worth. And I think that that issue regarding a recovery of feeling a part of the process, we saw in the post-pandemic aspects. We know that because people were involved in telework, this has created a sort of a feeling of loneliness and detachment from common work space in the traditional workspace and in the within the center of the workplace. So some of the experiences took place because we created workspaces where the employees felt they could identify and feel a sense of belonging and also listen to their coworkers. Same workspace. And I want to just point out the experiences that we've had with the digital platforms, employees that were working remotely, telework, who had an opportunity to discuss some of the factors that were involved in their health and well-being, and what were some of the proposals to improve this situation. Of course, this has to go hand in hand with the negotiations between workers and management to foster greater cooperation between management and workers. So we created in some specific areas where we looked at in the digital call centers, we created a space to discuss what were the factors that impacted on their health, also the time scheduling, the responses, the challenges that were faced with vis-a-vis the users of the service, the barriers, sometimes the language issues. We're talking about call centers and within looking at the different ways of communicating and expressing themselves, situations that could impede communication. So all of these things were viewed by the workers as priorities, where they first needed to recognize, first of all, their role as part of a collective effort, and secondly, the other the others are not detached from these situations, and also to formulate proposals where we know that specific proposals were submitted with the organization. The other collective action dealt with health workers during the pandemic in particular. They were in enclosed areas, for example, medical facilities, and especially with the nursing staffs. They went through a situation. They were obviously in the front lines, and they faced some very dramatic scenarios during the pandemic. And so there was a need, and this is something that crops up frequently with health workers. First of all, they need to be able to manage their emotions. Sometimes they need to hide their feelings because they can't be weeping, quote unquote, together or grieving together with the patients. They have to show bedside manner, they have to be sympathetic, but they also need to maintain a certain detachment. So sometimes you have issues where they empathize and commiserate the patients, and they don't have any place where they could address these emotional outbursts. And so efforts were made to create spaces. And one of our faculty mentioned this too. We were able to allow people to express their emotions, but in a healing mode. These sufferings were shared among everyone, and amongst all of the participants, looking at transforming that grieving and suffering into something more healthy. When you look at the social value of the activities, this is something that needs to be included. And when we also talk about strengthening the positive aspects that are focused on protecting the health of our teams, we developed another measure together with the surgical units at the School of Medicine. This is an experience where we've created a virtual space to allow for discussions on matters that impact on the well-being of health workers, looking at the organizational aspects relating to work schedules, those other factors that again deal with the emotions and the emotional well-being of workers. So this is based on a project, the ECHO project at the university. It's a project that was created in New Mexico, and this has led to the creation of learning communities. These learning communities are not just focused on one specific pathology or clinic. This is a learning process so we get a better understanding of what are the inner workings of our teams, and what are the factors that could pose obstacles or barriers to prevent increasing the well-being of our staff. These are based on a virtual platform, and in that platform, through basic discussions addressing in specific scenarios, we then have our participants share their reflections, and we also include the spaces to address, people are allowed to express themselves artistically, poetically. Even some have expressed themselves in song. And this, I think, reflects, again, and reinforces the value of teamwork. And again, this is a part of our effort to promote health and well-being in these workspaces. So I think these have been very fruitful and very positive experiences. And some of these were the first event is in person, and then the other events that are held monthly are virtual discussions. So this is a focus on, again, collective well-being, and this is something that we can certainly not underestimate in terms of its importance. Thank you, Fernando. Also, Maria. I think we've been able to, well, we still see the applause coming up and hearts being expressed. And again, I think this is just a sign of the appreciation and agreement that they have with many of the messages already shared. In other words, the idea of creating an environment where people feel they identify with the workplace without expressing themselves without fear of being stigmatized. I liked Maria's comments with the importance of stressing those. We talked about vacation, downtime, and also sharing in these emotions. We know that people sometimes will hide or cover up their emotions, but we need to also know how we can get around many of these issues. And for people who are listening, thank you very much for joining us. We're very pleased that we have an opportunity to have you all join us in this roundtable discussion despite the distances, and that we're able to listen from some of the perspectives of our experts. Now, Maria, I'd like to get back to you. As someone who is involved in changes, systemic changes, how do you think organizations need to start prioritizing mental health, especially organizations that are known for being very stressful? Maybe you could also discuss, well, what you've done with your employees is amazing, but maybe we could do a deep dive into what you think needs to be done so that we begin to prioritize some of the key measures required. Well, thank you, Claudina. Well, in the organization that I work in, stressful situations are impossible to avoid. What we need to do is learn how to better manage and channel many of these stressful situations. If you've done everything you could to address a particular issue, then that's good. You've done it. So, but we know that there are mental health challenges, and this is something I'm going to talk about on the basis of my own experience. I know that everything I'm going to share is based on my own individual experiences, not as a mental health specialist. And there are some specific mental health issues, including anxiety, burnout, depression, stress, that need to be addressed, and sometimes different other stressful disorders. So, and I don't want to ask a question, but I want to mention some specific errors that have been committed, especially when people are subject to burnouts. Here, I know that we have various unions and trade associations, and their businesses and organizations. For example, you have bus drivers, and we ask, how many accidents have we seen worldwide as a result of bus drivers who are either tired or they may be under the influence of alcohol? So there's so many cases of these types of accidents. In the health industry, we have misdiagnosis, and also sometimes even surgical instruments that were left inside a patient after an operation. These are issues. These errors take place because people are exhausted, they're overworked. And sometimes in the tourist industry, for example, I've made mistakes as a result of burnout. Somebody asks that we schedule a date for their tour on October 15th, and I make the mistake and I put October 1st. All of these mistakes are the result of burnout. And so my recommendation is that the organizations also need to think about their own well-being, because we're always saying that we need to start with ourselves, look into ourselves. And so when a business begins to think about its own well-being, they need to create safe spaces where employees can express themselves and be listened to with empathy and not fear of any repercussions. A second measure that I think would help significantly to address these challenges is to provide assistance by creating workshops that promote stress management techniques and also stimulate the practice of specific tailored vacations or downtime. We need to prioritize mental health. And if we do this, you're going to have happier employees, and you're going to have more productive businesses and organizations. So you need to start with management. There are many managers who don't understand the significance of having well-rested employees, because we know that they are also faced with highly stressful situations. So I think organizations with the CEOs and at the high-level management positions, they need to start thinking about prioritizing this issue so that in the future we have a more balanced approach in supporting mental health in the workplace, and also, as a result, with that balance, you also have management that is also addressing and improving its own well-being and mental health. Well, thank you. That's a perfect answer. And I hope that those who are listening to us today get that message very clearly. This is a key priority, especially, and I appreciate what you said, that we need to provide training for managers as well, so that they're well informed about those warning signs in terms of stress and burnout. So those who are managing these human resources also need to feel pleased and satisfied that they're doing everything they can to maintain that well-being that supports everyone. And also, when you discussed the fact that you have burnout, the importance of becoming familiarized with some of the repercussions that we see on mental health. Carmen is going to discuss a little bit about some of the guidelines that exist. These are guidelines provided by the WHO. So I'd like to ask Fernando, I know you talked about, and I see that there are some questions related to the projects that you've coordinated. Now, what best practices could be fully implemented by organizations to ensure that those that get the support that they need, how can they promote effective use of these resources? I think it's a key question, because usually mental health is something people try to avoid. They don't want to talk about it. So, Fernando, what are some of the best practices that you consider most appropriate in this context? Well, the complexities of the workplace, that sometimes we're offering opinions that could be interesting to implement, but the complexity of the workplace, and I know Carmen discussed the issue of the informal workplace and the informal market, and I think that's a critical issue. When we were talking about some of our experiences, we worked in the formal sector in our own case. We were working with 9-to-5 type of jobs. So from that perspective, and in our efforts, some sectors have specific vulnerabilities that includes healthcare staff and teaching staff. And this is going to have repercussions in the quality of health services and the safety of patients. And it also is going to have an impact on the well-being of faculty and teaching staff. This is crucial, and it's essential to support a country's development. So I think we need to target our efforts in these sectors. We need to look at, again, mental health support in those sectors, looking at the psychosocial and workplace priorities. So I think that there are two key instruments, at least on the basis of our own country's experience, and that is the creation of spaces for cooperation, where you have, for example, cooperation between management and employees, where they can discuss and give full expression to these psychosocial factors that impact on the well-being. For example, we were talking about having vacation time, downtime, and also we believe that it's essential. Recently, the WHO and ILO actually issued a warning, an alert on excessive work schedules where people are working more than 55 hours a day, a week, and how that has an impact. In fact, it was the key psychosocial risk factor. So we need to create spaces where we can negotiate. We can negotiate breaks, break time, and also in training, we need that break time. You need to have some specific organizational tool. And in my opinion, from that perspective, we need to have, again, these cooperation on both sides. These are spaces that need to be reinforced, looking at the well-being of workers, and coordinate with the healthcare sector, not just focusing on the biological, chemical needs, but we also need to include the psychosocial considerations. That's, again, essential. So from that perspective, in creating these forums where we foster cooperation and negotiation between both sides, I think this, again, and we need to prioritize the increasing challenges at the psychosocial level that leads to workplace violence sometimes, the need to have protocols in prevention and control. Violence in the workplace is another pressing concern. Also, the problems of substance abuse in the workplace. To address that with specific protocols, with an emphasis on its significance as a public health issue, not criminalization. This needs to be addressed through rehabilitation efforts. And at the university level, we have been working with trade associations, with employees, in creating these negotiation spaces so that we're able to create a more healthy workplace. So I would start from that end. I would, of course, in that same vein, in the negotiations, we need to set aside enough time so that people can reflect and express their feelings, to spread the word, and this requires, again, support from the institutions. Thank you very much, Fernando. I think spreading the word is a crucial message that you've underscored. But again, we need to change the workplace culture as well. That's essential, starting with policies, creating, for example, enough break time for workers. You talked about the 55-hour a week workload. And in addition to policies, we need to change the culture. There's a famous saying that leaders need to set the example, and we need to be able to create the enabling environment for introducing changes. We've been having this discussion now for about almost an hour, And to tell you the truth, it's so fascinating and it's so crucial for us that the time's just flying by. So I'm going to ask my colleague Carmen also talk about the measures, the mental health initiatives at the WHO level. How can governments, what can they do? What role can they play in ensuring that these policies are implemented effectively in the workplace?
Gracias,
Go ahead,
Claudina.
Carmen.
Muchas
Thank
veces
you, Claudina.
tendemos a
Frequently,
pensar
I think we
que
tend
está en nuestras
to
manos como
think
trabajadores
that
el
as
cuidar la salud
workers,
mental, ¿no? Y que
it's
solo lo
up to
podemos hacer
us
nosotros. Evidentemente,
to
partimos de
protect
esa
our mental
base,
health.
pero
And of course, we
efectivamente
start
los
from that
gobiernos pueden tener un papel
basis, but
fundamental también en
governments
esto.
can also play
Sobre
a
todo
key
porque pueden
role
fomentar
in these
conciencia
measures
real
because they can generate a greater
de lo que
awareness
supone la salud mental en el
about
trabajo y del coste
mental health
significativo
in the
que
workplace
conllevan
and the
esos problemas de salud
significant
mental
costs that are the
para el
result
trabajo, ¿no?
of a lack of support for mental health in the
Cuando vemos
workplace.
problemas de salud mental en
When
una
we look
persona
at
en
mental health
actividad
issues
productiva o está
manifest
trabajando,
in
no
workers
solo le
and
está
their
afectando a la
how it affects
persona
their
y a su entorno,
productiveness,
sino que
and it's not
llega
just the
realmente a
impact it's
afectar a
having on
las
the
empresas, a
individual
los
and the
a las empresas, al
surroundings,
lugar de
it's
trabajo,
also going
¿verdad?
to have
E incluso a la
repercussions, a
economía misma.
spillover
Y
effect
ahí es
on the
una de las claves
business,
en las que los
the
gobiernos tienen
industry, and
un
the
papel, ¿no?
nation itself. And I think this is where the
Los
governments
problemas de
have a
salud
role
mental
to
en el
play.
trabajo
Mental health
sabemos que
issues
llevan
in the
a
workplace
disminuir
can lead
la
to
productividad,
a reduction in levels
aumentar
of
el absentismo,
productivity.
¿verdad?
It
En el
increases
trabajo y a que haya
absenteeism
mayor
in the
rotación, ¿no?
workplace.
En los
And
puestos
this
de
also
trabajo, ¿no?
leads
Y todo
to a
esto
greater
evidentemente tiene
turnover in workers. So it has
consecuencias
all of
directas, ¿no?
that domino
Para
effect,
las
actually a
empresas y
direct
para la
impact
economía general.
on
Un dato
businesses
muy
and on
útil
the
es que
overall economy.
$1
One
invertido
useful data that we have
la
here,
atención,
statistic,
en el tratamiento de la
for
depresión y
every
ansiedad,
dollar that is
produce una
spent on
rentabilidad de
addressing
$4 en la
depression and mental
mejora de
health
la
issues
salud, pero también en
leads
la
to
capacidad
a
de trabajar. Por lo
fourfold
tanto, hay incluso
increase
argumentos
in
económicos
productivity.
al
So
respecto
we
que pueden
also
ser
have economic
tenidos en
arguments that
cuenta y pueden ser muy
support
útiles, ¿no?
these measures, and I think they're
Reconocer de alguna
useful
manera
to
estas
be
cargas económicas
referencing.
nos ayuda
So
a
this
fomentar
looking at the economic
esa
repercussions
protección,
as
esa
well, I
promoción
think
de la
that
salud
will
mental
spur
y que
on
se
even
pongan en marcha las
greater
intervenciones en ese
success
sentido,
in
porque al final
creating that
invertir
awareness and
en este tipo
implementing
de
new measures,
programas
because by investing
mejora
in these programs,
evidentemente en primer
we
lugar el bienestar
obviously
de los
are going to
trabajadores, pero
increase the
también del
well-being of
ambiente
our
en general
workers. It will also create a
laboral, ¿verdad?
workplace
También
that
reduce
is more
gastos a
conducive
nivel de
for
la
improvements. It
atención
also
médica,
leads
¿no?
to a
Incluyendo la seguridad
reduction in
social o los gastos
healthcare costs,
individuales en
Social
algunos
Security
casos,
and
y también
individual
tiene un
healthcare costs.
rendimiento a
And
nivel
it
de las
also
organizaciones que va a mejorar.
increases the
Y
levels of
finalmente esa
performance of
productividad
organizations,
económica
productivity.
que
Economic
conlleva.
productivity, after all, is another
Y en este sentido,
byproduct of
los
this.
gobiernos
So I think that governments
tienen un
have
papel
a
en ofrecer
role to
esas
play
orientaciones,
in providing
regulaciones,
that
políticas
guidance,
públicas, ¿verdad?
providing
Que
public
favorezcan
policies and
precisamente
procedures
que el
that
empleo, que la
will
salud, que la seguridad
ensure
estén en
that
consonancia y
health and
vayan
well-being
a la
are
par, ¿no?
aligned
Y que se fomente de
with
alguna manera la paridad,
this
como
and creates
comentaba
at the
antes
same time,
Fernando, ¿no? Entre la salud
as
física y la
Fernando
salud
mentioned,
mental.
we need to have that equal
Y en
balance
este
between
sentido, pues que
physical
se
and mental
implementen de verdad
well-being.
esas
And these need to be
intervenciones ligadas
implemented meaningfully.
a esas políticas públicas, ¿no?
This goes hand in hand again with
Es importante
providing
que se
these public
garantice que las
health policies. We
leyes
need to
se
ensure that
ajusten a las
legislation
normas internacionales de
is
derechos
also
humanos. Entonces, por ejemplo,
adapted
si
to the
pensamos que los
international
problemas de salud mental en el
standards. And
trabajo
if we look at, for example,
tenemos que
mental
tener en
health in the
cuenta que hay que
workplace, we
regular
need to
la no
understand that
discriminación
this,
de los
we also
trabajadores que tienen problemas de salud
need
mental, ¿verdad?
to support the
Que se
measures,
estén
non-discriminatory
contemplando cuestiones
measures
como la
that we
confidencialidad,
need to
como
address things
las
such as
iniciativas que permitan
confidentiality
un
in
apoyo
expressing
en
problems
el
or
trabajo, ¿no?
concerns
Para
in
personas
the
que tengan un problema de
workplace
salud mental y
for
que puedan
people
estar
that do have
trabajando, pero
mental
que
health
requieran algunos
challenges that
ajustes
can continue in the
que sean
workplace, but they
razonables,
need
¿no?
some
También
support
programas
and
para reincorporarse al
changes that are
trabajo, por
reasonable.
ejemplo, después
Also,
de una
the
situación de
reintegration into
depresión, de
the
un burnout,
workplace after
etcétera,
having
¿no?
suffered from burnout, from depression,
También
to
los
be able to
gobiernos
bring
tienen
them back into the
un
workplace.
papel a la
Governments
hora
also have another
de fomentar que se
responsibility
creen
when it comes
capacidades
to
en atención primaria en
foster
salud
these capabilities in health, mental health, occupational safety, and in mental health. There's an acknowledgement of these workplace mental health issues. They need to include evaluations and identify specific needs of workers, changes, and give a better understanding of some of the changes that are required, and explain that these are for health reasons. And at the same time, they're providing interventions, psychosocial interventions that will also be relevant to the workplace situation. It's also essential that we foster or promote these very well consolidated paths. You have social, you have healthcare pathways. We can create initiatives that will provide for that cooperation in all of these sectors. And at the same time, they are successfully supporting workers when they need these services. We know that intersectoral crossing of, again, I know we use intersectoriality to a great extent, but we see very specific success stories and examples as to how we can have a business work together with the health services, social services, in order to ensure that we have a more inclusive policies and that we're able to foster the general well-being in the workplace. And I would finish by just saying that governments can also support the guidance measures in psychosocial services. We're always used to talking about other risks in the workplace, but we always lose sight of the mental health and psychosocial priorities. And in that regard, we need to look at other issues such as violence in the workplace, harassment in the workplace, discrimination, and in this regard, we need to include people with mental health challenges that require that support, that require those joint efforts, and workers together with the management area, they need to jointly assess these issues, and they need to have a voice and a vote in the process. So when we're asked what can be done in response, well, the responses are sometimes found within the workers. That way we can help mitigate and more successfully check these issues so that, again, we can foster well-being in the workplace.
Thank you very much, Carmen. Excellent response. And I believe that amongst the three panelists, we find something in common. That is to say that we talk about it, that we have this culture of talking to people, pondering upon things, and it is not only up to governments, it is not only up to us, but governments will play an essential role. They play a very important role so that we can have healthier workplaces, and then the burden on public health services drops and the economic productivity improves. So when you talk about the fact that it is also important to talk about change, what does this mean? $1 for someone and the profit is much more. This has been fascinating. I don't know whether you realize that we started at 11 on the dot, so we spent a whole hour talking about this, and I feel that I want to go on talking about this, but it is also high time for us to hear and to listen to our participants. Maybe you have some questions that you've added to the Q&A chat. Then I see that there are some questions. I won't be able to read all the questions, but we'll do everything possible so that we can answer the questions and the comments raised by our participants. And one for Maria is how can we, and this is really interesting, a very interesting question. I believe that you've already discussed this, Maria, but the question is, what can we do? And this is leadership. How can we change the mentality of top management in companies when they're used to having workers available 24/7? Excellent question. Excellent question, Claudina. I believe that changing the mentality and the approach of top executives in companies and organizations, in my opinion, is impossible. We have to begin by changing our views, our reactions, and to learn. And as I said previously, it is difficult, and I even got emotional because I thought of this, and it was the most difficult process for myself. But setting limits is something very important, and setting limits doesn't turn you into a more or less efficient person. You just have to set limits. You're hired to work 8 hours. So you're hired to work 8 hours, and that does not mean that you're going to vanish when you can do that, and you could obviously do that. But if you want to feel empathy with the company, with the business you work for, you can be available without feeling abused, without you feeling that your time is not respected. And when you start setting limits, I am sure that your boss will understand, and he will understand that they're overdoing it, they're going beyond the limits, because many a times we have a very high demand. We have a high demand in our companies, and sometimes we go to our co-workers, to our fellow workers, not paying attention to the fact that they also have a life, that they have a time, and they have to live and enjoy their life as they deserve. So I feel that there's no way of changing our bosses if you don't learn how to set limits and you learn how to say no in a loving way, with love. And you can say, I'm really sorry, Rafael, you're calling me, and it is already after hours in the work I do. And now I'm at the movies with my children, and I cannot help you. Hopefully, you can find help soon, and you can solve the problem that you're trying to solve. Period. That's it. You don't have to resort to creating a disagreement in order to set limits to things that don't want to do in our free time, during our free time. And it is something that should not be negotiated. It's not subject to negotiation. Thank you, Maria. And the fact is that when you started, and you talked about this because you've had to deal with this in a very profound way, and you're talking, and what it means is been there, done that. You know what it is to walk with those very tight shoes, and you know what that walk means. And it is a risk that people run, that people take when doing this. So you come from that, you know what it means. And I greatly value your answer. So we're talking about the importance that this has for each one of us bringing this change. So thank you very much for your advice. Very important. We have several questions, so it is difficult for me to select out of so many. But Fernando, there's one that's very important. And I will ask two questions at the time, one for Carmen, in order to reduce the stigma for employers as well as for workers. And then I will turn to Fernando so that he can talk a little bit about delving deeper into psychosocial risk prevention, including violence and abuse. So, Carmen, maybe you can tell us a little bit about these interventions.
Disculpa, Claudina.
I apologize, Claudina. Interventions to reduce stigma? Is that what you meant? Yes, in order to reduce this stigma. What are these interventions that you recommend? So the question is interventions in order to reduce the stigma, both for employers as well as for workers. What do you recommend? Well, perfect. I feel that first and foremost, I would say that it is important for us to understand that a stigma has different sides to it. Stigma is sometimes only linked to our thoughts, but it is true that obviously when we have a stigma established within a specific population, and let me give you a specific example, LGBTQ plus, so we're talking about the working environment. It is easy to have a whole set of things. You attribute several thoughts saying that this person shouldn't be working here because they don't have the same abilities or skills, or placing or giving you different examples because I believe that they shouldn't be taking care of the public or looking after the public because of certain characteristics, physical characteristics, maybe. But at the same time, there's another component of the emotions that it brings out in us. And sometimes it has to do with they could make you feel rejection. And there's another component that leads us to behavior, to discrimination as such, where, for example, as a manager in a workplace, I can decide that I will give a priority to another person for a given position, for a given job, different from another person with a specific condition. So in this regard, we have to think that we have to be working at different levels. Obviously, first and foremost, the most important thing is to go back to what we have been repeating at different times. Talk about this. Let us do away with the silence, keeping silent about these mental health issues in any field, but in particular in the workplace. And in this sense, in order to do away with this stigma, it is important that we talk about what we're discussing. And I'm thinking about a concrete example in my office here not long ago. We realized that as a group, we were in the office and we were faced with a certain problem that had to do with the matters of stigma. So what we did was to organize a workshop amongst us where we talked about it, just like the way we're talking here, and we provided information because sometimes it has to do with a lack of information about that problem, that specific problem. And we started talking about what each one of us was dealing with, but facing all these issues. But this, in a way, will not change the situation overnight because a stigma, unfortunately, is deeply rooted. And a stigma with the mental health problems has been going on for a long time, and we won't change it all of a sudden. But it is true. And we see that being able to talk about it brings a solution. And at some point, I felt really impotent because I was no longer able to work. I was not happy because of other situations, and that was reflected in the workplace to be able to talk about it and to be able to provide support amongst us as fellow workers, as co-workers, but also with the strong training for the employers, for the managers, for everybody in the office, so that in a way they themselves can understand things and they will prevent these situations from taking place. So just some ideas that I launch for your benefit. Maybe another one of the colleagues, Maria or Fernando, have something to contribute to this question. Please, Maria or Fernando, I would also love to hear from you. What are your views about this? Fernando, please go ahead.
No, yo creo que en la misma línea
It seems
que
to me that
planteaba
along the same
Carmen,
lines
la
of what
necesidad
Carmen
de
was saying,
derribar
the
barreras.
need
Hace poco
for
estuvimos en un
bringing
seminario
down
que iba
barriers.
vinculado a una
Recently, we had a
problemática
seminar that was connected to a
del
specific
espectro
problem
autista
regarding
y
autism.
la actividad fue una actividad
And the
organizada
activity
entre
was
el
an
espacio
activity
salud, digamos,
organized
la Facultad de
between
Medicina de lo
the
Velar
School of
y
Medicine
las clínicas pediátricas y
and the
psiquiátricas
pediatric and
psiquiatría de
psychiatric clinics
con
for children
comunicación, con la
with
facultad
communication,
de la
with
información y la
the
comunicación, la FIC.
power of
Era interesante su
communication
proyecto
and
justamente para
information. It is
romper
interesting. It is a project in order to
con los
bring down, to
estereotipos que
break
se
away
tienen,
with the
tanto
stereotypes that we
en el
have,
espacio social,
both
en este
in the
caso
social space, in
educativo
this case, educational
principalmente,
space, essentially,
familiar y
a
barrial,
family
digamos,
space,
social.
social
Era, el
space.
proyecto es
And
justamente
the
derribando
project is
barreras. Yo creo
precisely
que,
that of
parafraseando ese
bringing
proyecto,
down
algo
these
similar en
hurdles
el área de la salud ocupacional,
and
o,
something
perdón, en
similar
el área
in
del
the area
trabajo,
of the
visto desde la
workplace and
perspectiva del
the labor
bienestar y de la
force,
salud
looking
ocupacional,
at it from the
es
point of view of
derribar
occupational health.
barreras
It
que
is
hacen
bringing
que
down these
tanto trabajadores como
barriers
empleadores
that lead
tengan,
to workers and employers both.
asignan estereotipos a las personas que tienen algún
assigning
problema
stereotypes
de
to
la esfera de
people
salud
who have
mental.
a
Y ahí hay que
problem in the
trabajar
mental health
cultura, sin duda, hay que
sphere.
trabajar
And we
mucho
have to work on culture.
en la
We have
tolerancia.
to work
Hay que
hard
trabajar
on
también desde otra
tolerance, and we
lógica. Yo creo
also
que hay
have
que
to look at
estimular el
it from a
empleo a
different
su
point of view. I
vez
believe
por
that we have
vía de
encouraged
ahí el rol
employment,
de los gobiernos
and this is where we
en
bring
cuanto
in
a
the role of
facilitar
government regarding
fomentar
facilitating or
a través de
promoting
distintos mecanismos
this through different
impositivos, por
mechanisms,
ejemplo,
taxes, for
fomentar el
example,
empleo pleno
promoting
para
full
toda
employment
persona como un
for
derecho
any
humano
individual,
básico
any person as a basic
a
human right,
ejercer y que el Estado de alguna
and
manera
for the
tiene que ser
state,
garante
in a
del mismo,
way,
por lo menos así
to
lo veo
guarantee
desde esa
this.
lógica. Entonces,
This
me
is the way
parece
I
que en
see
ese
it from this
sentido hay que
point of view. So it
trabajar
seems to me that
mucho en
we
lo
do have to
cultural,
work hard on
empleadores
the
y
cultural
trabajadores,
side
pero
of it,
también
employers and workers, but
con
also
políticas activas
with
de fomento
active
que
policies to
estimulen, digamos,
promote this
la
that
inclusión
will encourage
y
inclusion
y la incorporación de toda
and
persona, digamos, por su derecho
including
al
any
trabajo. El
person,
trabajo que es
their right
generador
to
de
work.
dignidad,
Work
de
brings with
capacidad, de
it
promoción de la
decent
salud,
life, health
es un
promotion,
inclusor social
and it
central.
is a social
Las políticas que
inclusion element.
dirigidas
The
al
policies
empleo,
that are
no cualquier
addressed
empleo,
to
digno,
employment, and
decente,
not
como se
just any
mencionó
job, but
anteriormente,
decent,
es de las
dignified
políticas
employment.
más
This
importantes de
is one of the
salud
most important
pública, porque
policies
el
in public
empleo,
health
no solamente
because
por el empleo en
employment
sí
is not
mismo,
only for
sino
the sake
por
of
los bienes
employment,
y servicios que
but because
accede la
of the goods and
persona
services
y
that
que
people have access
determinan
to
en gran
through it,
parte
and that to a
su
large
condición,
extent determine
factores determinantes
their
de la salud y el bienestar de la
conditions
población. En
that
fin,
determine their
por
health
ahí
conditions and the
pensaría.
well-being of the population. So this is my got it.
Muchísimas gracias. Creo
Thank you.
que la respuesta es
I
bastante
see that
clara y
the
coherente.
responses are
Me
very
gusta mucho
clear.
esta pregunta porque no
And
podemos
I
hablar
really
de
like the
siempre
question
cuando estamos hablando
because
de salud mental,
when we're
el tema del
talking
estigma y
about
discriminación
mental health, we know that the
como un
stigma and
tema que las
discrimination issues
personas
always come to the
muchas
surface.
veces callan, no quieren
And
hablar por ese
frequently
miedo
people just don't want to
ser
talk about
juzgados,
these things because they're afraid of being judged
y muchas veces la
and
persona no
sometimes even
sabe,
afraid of
no
losing their
sabe cómo
jobs.
abordar estos
People
temas.
don't know exactly
También me ha
how
encantado
to navigate
de
these
esta
issues.
mesa
So,
verlo en esa
one thing I really
perspectiva es que
enjoyed from this
ustedes desde su
roundtable
punto de
discussion
vista nos
is
han
that from
llevado a
your
conocer la
perspectives,
importancia de que
you've
hablemos,
helped
de
us
que
to get a
pongamos
better
en guerras,
understanding about the
yo
significance,
hablaba
the
de
need
la
to,
palabra, Carolina,
for example, spreading the word.
cada uno de ustedes
And
han
each one
presentado
of you
ejemplos muy
has
claros y
given us
eficaces
very
de cómo
significant
podemos
and key
nosotros fomentar
examples
una área de
about how
trabajo
we can
en el que las
promote a
personas puedan conversar
workplace
con
that
salud
will
mental.
allow
Miren, ya
people
estamos
to
casi, nos queda
express
un par de
themselves
minutos para terminar
and
y
discuss
la
these
verdad es
issues.
que
So we
no
just have a few
quisiéramos,
minutes before
normalmente
we're
800
scheduled
personas
to end.
conectadas.
We have more than 800
Veo que
participants
esto se
who've
está
joined us,
acabando.
and
Vamos a hacer,
I know
hacerles
we've
llegar a los que no
recorded
están
this, so
conectados.
we will
Una
definitely
disculpa
provide
si en
that
su
those recordings
momento
for
no
you.
logramos
And
contestar
please
tantas preguntas, pero sé que
uh,
hay varios comentarios
excuse us if we didn't
muy
cover everything,
interesantes.
but there are so
Eh,
many just fascinating questions
Creo
that
que
have been
sería
posted.
interesante,
So I think it would
vamos a
be,
revisarlas. Hay
well, we're
una
going to review
pregunta,
all the
María se contestó
questions.
sobre, sobre
There's one
compartir la
question
información del
posted
proyecto
here about
ECO. También
sharing
preguntaban sobre
more
tu
information about the
contacto,
ECHO
María.
project. And I know also the contact information. Yes, Maria. Yes, I'm going to share that. I'm also going to provide information about the foundation, and I'll give you the email
Richie,
address. I'll
Arancha,
share that
Carolina, Juan
information.
Catalina, por favor, pueden
We
poner
have
ahí en el chat su contacto y
Arancha,
María
Catalina.
en
If we could
el
post all
momento
of the
lo va a
contact
compartir.
information, no problem.
Yo quiero terminar a tiempo
And
porque creo que es parte
I want to
también del
finish on
respeto
time because I
a
think
los
that's
horarios.
part of our
Y me
effort
gusta
to
ser
respect
estricta,
everybody's
protegerlos hacia el final.
time schedule.
Me
And
encantaría
so
seguir con esta
I would love to
conversación, pero
continue
hemos
with
de
this
terminar.
discussion,
Entonces,
but I
antes
know
de
we're
terminar,
scheduled to finish. But
podríamos
before
tomar
we
un momentito
conclude
de
the
reflexionar
discussion,
para cada uno
well,
de
we need to just
ustedes.
take a pause for a moment to
No hay
reflect.
ningún orden especial,
And
sino que
there's no
como consideren
specific
apropiado.
order of
Que se
priority
les diga
depending on who wants to start? If you could just, as we conclude now with some parting words, could you share some specific final remarks that would help our organizations to move forward in this? So if we could just have some final remarks from each one of you. Well, let me start. I just want to end by saying that please do not be fearful. Please feel that please feel free to be able to get that empathy, that compassion. Whatever you need to do, do it so that you enjoy your work more fully. And by saying that you're suffering from burnout or you're tired, you need a break, that's something that can save lives. And don't be afraid to express that. You might even save your own life. And based on my own experiences, I finally had the courage to say, look, I need a break. I need vacation time. I need to take that pause so that I can rediscover myself and find things that I didn't even know that I had. So, and thank God that I was able to decide and make that choice between being a victim or moving ahead. And even more than just moving ahead, I was able to think about those people in a similar situation that have decided not to take that break and take that pause. Sometimes it's because they can't afford to take time off. Sometimes we're afraid. I personally was afraid that I wouldn't be able to pay my rent. I was afraid I wouldn't be able to pay my children's school tuition, and I was afraid that the clients wouldn't able to find me when they needed me. So I was constantly looking for excuses to not ask for time off. And I invite all of you to please show that courage and that necessary will to say, look, I'm tired and I need to take a break. And I can assure you that you're going to, through your lives, to be able to renew and get the best of yourselves, the best version of yourself. This is something that I'm very, very pleased that I was able to share with you in this discussion, because I know in the past I felt ashamed about doing this, but now I'm very proud to have taken that step forward, that I was able to express my own concerns and voice. And I want to thank Carmen and Claudina. This has been a meaningful experience for me. And if anyone who's joined us, anyone is in Madrid here, we are going to the first Ibero-American conference. We actually had this event, and it was very successful. Last year was the first one. This year, we're going to do it in Madrid on October 24th. It's the second Ibero-American group and convention, and we're going to address burnout. I'd like to invite all of you, and those that want to participate, just get in touch with us through the contacts. And I think this is going to be very helpful I think, with this second discussion. Thank you. Well, thank you very much. Amen.
Claudina,
Claudina,
ya que me invitaste,
now
lo
that
que
you've
decía María
asked
es
me
muy
to
importante
share
esa,
my perspectives,
digamos,
I
esa
think what
reflexión
Maria
también
pointed
individual,
out is crucial, to have that
compartirla,
individual
con
perspective,
otros.
to
Me
be
parece que
able
es un
to
tema
share and
importante
express those
en este
feelings with
mundo
others.
acelerado que vivimos,
In this very hectic
postmoderno,
world
siempre
that we
corriendo
live
detrás
in,
de
this
algo.
postmodernist, hectic world,
Me parece es muy importante
I
hacer una
think that
reflexión
it's
individual.
crucial
Pero por
to
otro
be able
lado,
to
yo creo que es
share our
necesario
perspectives, our
redefinir
individual
los modelos de
perspectives and
ocupación laboral
reflections. But we also
en
need to
todos los
discuss the
sectores y
various
algunos más que otros,
workplace
pero
models to deal
rediscutir
with
los
this.
modelos de organización
We need to
laboral
discuss the workplace models so that we can regain that collective spirit in the workplace. And I think that's part of our prevention measures in strengthening psychosocial responses in the workplace to provide sufficient break times and vacations, leisure time. And this issue, I think, is closely aligned with workplace restructuring measures. All of that needs to be discussed. And by recovering that collective spirit, that does, and it helps us to dispel this myth that those of us who are working in an isolated way, that our coworkers are competitors instead of coworkers. And it's, of course, competition is an important issue, but when that competition reaches the point where it's a rivalry with others, this is very harmful for the mental health, well-being of the individual, and it also spills over into the collective workspace. Thank you very much. I think it's been a very fruitful exchange of ideas. Well, thank you. I think that the colleagues have shared some very practical perspectives, and I think just getting back to the need to take the time to share and discuss our concerns. I think in the workplace, we need to also talk about the workplace conditions. We need to talk about the risks that we are taking on. And hopefully, as was already clearly stated by Maria and Fernando, we need to share our feelings. And we also need to jointly, again, vent and discuss these concerns. And it's going to help us to identify specific strategies that might be successful with one working group, and some are going to be common, some may not be applicable to other workplaces. We need to look at, for example, the need to create those spaces for physical workout and provide enough time for rest, relaxation. All of that is going to contribute to the well-being, physical as well as mental well-being of the workplace, looking at how we can formulate and develop strategies. Maybe we can also test some of these theories. How do we deal with stress and conflict? How can we identify such problems as workplace harassment? All of this is going to be crucial. We need to put this all on the table for discussion. Without doing that, we're not going to be grappling with these key challenges. Now, we know that at PAHO, we have committees devoted to the well-being of our human resources. And these can be very positive examples to share. But it's also important that if we don't do this with the support of management and administrators, if we don't raise that awareness in our training, it's going to be highly challenging. So it is a collective effort, but I think we've shown with many examples today, we've already shared many useful, specific measures, and although they do pose major challenges, I think they can be implemented to meaningfully improve mental health well-being in our workplace. So again, thank you very much for giving me the opportunity to share my perspectives with Claudina, with Maria, Fernando, and I'm also taking back with me a lot of very useful experiences and recommendations. Well, I think we've reached the end of our discussion. Thank you very much. It's really been a deluxe event for us to have these outstanding and talented panelists like you. and people who very easily shared many of their experiences, personal experiences in dealing with stress, and how you prioritize mental health policies and tools. So I really enjoy this very enriching discussion. At the beginning, I thought, well, when we have webinars, we usually need PowerPoint presentations. Well, for this one, we didn't need any PowerPoints. It's, again, been a very highly rewarding experience. And I invite you all to consult the PAHO website, where you're going to find a lot of tools, a lot of resources that will, I think, continue to guide us in our efforts in promoting mental well-being in the workplace. And as the panelists have already indicated, this is, again, essential because it's not just something that is a deluxe package. It's important that we prioritize mental health in the workplace. So with that, we conclude our discussion. And again, thank you very much for joining us.